Hello everybody, you're watching my introduction to me and a review of an article that I read that I found super interesting regarding different types of tube feeding and methods for doing that. But to start, just a little bit about me. I am a second-year nursing student. I work as a server and a cook in a restaurant. I also clean at a gym and do some training there. I also run a direct sales company that I'm growing a very large team around the area, and that's kind of what I really like to do. I played a lot of sports in high school. I played baseball, track, cross country, basketball all 4 years, and I really enjoy being active. So for this study, it was something that kind of related to me as far as my grandmother was going through some issues this April and actually ended up passing away, but we were kind of debating whether to use a feeding tube to help her to eat. And so I thought that a feeding tube would be a cool thing to talk about. And I found a study that was comparing the different effects of continuous tube feeding versus bolus tube feeding on glycemic variability, insulin usage, the tube feeding amount, and the caloric uptake of the patient. And basically the reason they want to study that is because high glycemic variability when people are trying to recover is no good for recovery. It actually causes endothelial stress and is not helpful to someone trying to recover. So they want to limit that as much as they can. So the methods for the study include, it was a pilot study of 50 patients, ages 18 to 89, and they were all critically ill. They were unable to eat for themselves, and they had just gotten a feeding tube through their stomach, which is called a percutaneous endogastric tube, tube. And they were tested for applicability to the study, randomly assigned either bolus tube feeding or continuous tube feeding, which continuous is a constant influx of nutrients 24 hours a day, while bolus would mimic more eating 3 square meals where they bombard you with nutrients. They obviously had informed consent. The methods are very objective. They got Apache 2 scores and GCS scores and tested for disparities in age, gender, BMI, and injuries. So they kind of accounted for the big things that might make a difference as far as measuring glycemic variability, insulin usage, tube feeding volume, and caloric uptake. And the results are actually pretty surprising. There is hardly any difference. And the discussion and the way that might be clinically important is that we should not think about the type of tube feeding as much as we should be thinking about the individual situation, the cost effectiveness, the serum that we're actually giving patients, because if they're not high quality serums, the body is still not going to recover. And the way that I know that this is a quantitative study and it's a scientific study is because it was carefully conducted. It was systematic. There was a hypothesis. They tested, they controlled for different variables, and there was a method section that included a lot of number data. And when they reviewed it, it was very objective. They broke down the measurements into 12-hour epochs. I think that we should apply this to individually tailoring if somebody needs continuous tube feeding or bolus tube feeding as far as if they're trying to recover or not. So that is my review of this article and a little bit about me. Thank you.